So welcome. Thanks so much for joining us. This is our second, possibly annual HealthTech Showcase, and we named it the Cascadia HealthTech Showcase, hoping to grow it out into a regional event, bringing in innovators working in health plus tech plus data. Here's the spot I'm supposed to be standing. That's a good example. Set a good example. So really interesting space. And there are more events coming up showing off groups and companies in this space. Next Tuesday, Design for Healthcare Meetup is having an event downtown here at the Best Buy, and it's focused, they have a number of people from companies coming to speak at that event who are working in user experience and healthcare type products. So that's one to watch for. Xconomy has one coming up in life sciences. I've forgotten what the date of that one is, but I think it's early November 6th, if I believe. So it held at Seattle Children's, but it's data and life sciences solutions. So those are two of the neat events coming up. Seattle Health Innovators, we have been around since 2013, founded by, where's Ed? Ed, yes. He was prescient and saw the need for innovation in healthcare and just the need to bring people together who wanted to do something together. So we're a grassroots organization, all volunteer, and now we have more than 2,000 people on our meetup list. So it's a good group of people, professionals that I'm sure you're enjoying meeting tonight, tech people, nurses, doctors, healthcare, administrators, all sorts of people come together around healthcare. And I know Cambia Grove was formed about that same time to bring innovators together around healthcare, thinking that it would be a good spot for venture funds. But it's taken a while for things to start to gel, and so we saw a long learning curve in healthcare. Surprise, surprise. It's a very complicated space, long timelines, but now I think we see a real burgeoning of opportunity. And any of you who are over at GeekWire today, they had a healthcare track. So there are definitely some exciting companies coming forward to set examples for us. Okay, I would like to, let me grab my slide changer. Oh, whoops, too fast. So this is our kickoff for the fall, and our next event will be the holiday event where we celebrate healthcare innovators with our awards. And this is our 5th annual awards, and it's a lot of fun. We have categories across the spectrum: clinicians, county people, public health, startup companies, individuals, but we're calling out individuals who have gone above and beyond their job roles and really done something to start to change healthcare or change healthcare. So think about who of your peers, it matters if you put a little bit of time into these applications, who of your peers would be good candidates to be nominated for an award. The nomination process is quite easy, but it's very meaningful, and it's a lot of fun coming out to that final event to celebrate who the winners are. Yes. Step into this ring, Scott.
Hi, this is Scott. I'm this year's chair. Thank you, Terry. You'll see little cards around, just a helpful reminder, pick one up. It just tells you where you can go to healthinnovator.org to fill out the application. So look for one of these on the tables.
Great, thank you, Scott. I would like to thank our sponsors. We have good food and wine. Thank you to Department of Commerce for that. And we were speaking with Julia Turlinchamp at Commerce, and she's really enthusiastic. Commerce in general is very enthusiastic about this health IT sector. It's really starting to take off, and they are big supporters of it. I just want to read her statement. She couldn't be here today. Commerce recognizes the health IT sector as a fast-growing and promising area of Washington State's life science ecosystem. We believe that this is due to the entrepreneurial drive and remarkably innovative spirit of our community. We appreciate the opportunity to support the work of this group and look forward to continuing partnering in the future. So, thank you, Commerce. Now I would like to thank Fenwick & West. Fenwick & West has been a long-term supporter of Seattle Health Innovators, and so they also came in as a sponsor for us for this event and for the annual awards. So next I would like to bring up our MC. Here she is. Great. Jaren Walker. I will also read her bio. She is with Tech Alliance and worked with Congresswoman Suzanne DelBene, where she led the outreach efforts for STEM education and emerging technologies. So you're in your comfort space. She recently graduated from the University of Washington, specializing in international data privacy and tech policy. Prior to working for Congress, Jaren worked as a gender-based violence program assistant at Seattle Pacific University while she pursued her undergraduate degrees. As the newest member of the Tech Alliance, Jaren is excited to continue educating and advocating for our innovation communities to help drive our economy forward. So welcome, Jaren, and thank you for leading us through this program.
Thank you, Terry. And thank you to Seattle Health Innovators for this incredible event. I've just had a chance to meet a couple of the companies, and I think we're in for a really great presentation. And especially thank you to Cambia Grove for this incredible space. As mentioned, I am the program manager at the Technology Alliance, so just across the way over on 5th Avenue. And just out of curiosity, has anybody heard of the Technology Alliance? Beautiful. Okay, so for those of you who haven't, you're also beautiful. What our key mission is basically to educate our policymakers and facilitate a research institution economy, and as well as overall just supporting entrepreneurship. And those three things basically all boil down to one thing, which is why we're all here, right? To share ideas and to convene, which is the key of success. With that, I want to make sure that there are two programs on your radar. From our Technology Alliance, we have the Discovery Series Luncheon. If you haven't heard about that, I would love to talk to you more, because we have one coming up just next Friday. And the second one, on December 12th, we're going to be hosting our first ever public policy conference on artificial intelligence. And this is the what's what and the who's who of AI, specifically for how keeping Washington competitive. So with that, I would love to chat with you more. Again, that's coming up in December, and we have sponsorship and tickets still available. Before I turn over the microphone to Jessica Hoffler, who's one of the other partners here for this event, our presenters, if you would, please line up by the bar. Jessica is also waving over there, alphabetically preferred. Thank you. And Jessica, I'll turn it over to you.
Hi, I am one of the Jessicas here. My name is Jessica Hoffler. I'm the program director here at Cambia Grove. Thank you all for coming. Cambia Grove is a healthcare innovation hub, and we work to bridge the gap between innovators like you and the traditional healthcare system. Part of our work is to break down barriers to innovation in healthcare. And one of the barriers is that there is not enough opportunity for early stage companies to be showcased in a public forum. So we're super excited to have you all here today and for this program. Another barrier to innovation is around data. And we heard from our series solutions that we, innovators, change makers, need access to data. They want to get their hands on data. So we developed a fellowship program last year, brainstormed a fellowship program last year to give people access to data. And we were really fortunate to develop a great partnership with the folks at Fred Hutch, and they were eager to embrace innovators like you all into their programming. So I'm happy to have our first Cambia Grove Innovator Fellowship program profiled tonight as part of the programming. And I'm going to hand it over now to Michael Zager, the Director of the Center of Data Visualization.
Hey, you guys come up. Awesome. You should actually be applauding for them. So about 4 years ago, I got involved with Fred Hutchinson after a long career in advertising, and it was a huge transformation for me. When working at the Fred Hutch, you work at especially in data visualization, you work at a very interesting intersection between having to know about machine learning and having to know about biology and having to know about raw computer science in order to start to bring this stuff to life. And so when I heard about this Cambia Grove initiative, and they were like, oh, we're going to give you some fellows for like 6 or 8 weeks, I was like, I don't know. Is that going to work out? Like, is that enough time to make impact? I mean, it's a lot. But I knew that Kristin came to it with a lot of background in biology, and Mansi came to it with a lot of background in computers, and it's going to blow your mind what they've accomplished in the last 6 to 8 weeks. I feel like a proud papa. It's like they've been amazing. So with that, I'm going to hand it over. Thank you.
Hi, everybody. My name is Mansi Mehrotra, and this is Kristin. Thank you, Michael. And we're both the Data Innovator Fellows sponsored by Cambia Grove, working with Fred Hutch. What we're here to talk to you about today is this very cool project. It's developing cloud infrastructure for supporting genomic research, which is basically going to encapsulate 2 projects that Kristin and I have been working on for the last 6 weeks. We're very proud of it. And before we dive in, we just want to walk you through who we are and what led us to where we are today. So hi again, my name is Mansi. I am a grad student at the University of Washington, and I consider myself a programming enthusiast. I entered the field of computer science by doing my undergrad in computer science from India, and then I worked with Maven Systems, which is in the IoT space, for building some kind of Android applications that would help them. I am not particularly close to the healthcare sector yet, but the closest I've been is when I built an Android application for them that helped identify when an accident occurred in a 2-wheeler vehicle, which was not something very popular back in India in the early 2010 maybe. So I had built that. And then I realized maybe I want to understand a little more about what the business world is and how do businessmen think, because maybe that'll help me solve problems better. So that led me to join Vue as a product manager. And for 3 years, I worked on their content management system and did a lot of data analysis, but more on the qualitative side, nothing too mathematical. And I realized maybe I need some more tools in my toolkit to actually do my job better. So I'm here now at the University of Washington, studying statistics and focusing on machine learning. But I'm also fortunate because I'm getting a chance to work with companies like Starbucks and Fred Hutch to do some kind of analysis that is kind of enhancing my education. I've also worked with Adobe and the University of Washington's medicine school for some kind of product development that they needed. And this is where I'm headed at. I hope to be a data scientist in the future, and I feel I've been taking baby steps towards it, so hopefully someday I'll be there. Handing over to Kristin.
Hi, so I'm Kristin, and I'm interested in building life science data products. Primarily my background is in life science research. So I did my PhD at UW in the pharmacology department. I completed that in 2016. So I liked a lot of things about working in biology. I liked kind of working on problems that were helping to improve lives, kind of had a healthcare application. But when I was doing my PhD, I also got interested in kind of the business side of science. And so actually, while I was working on my PhD, I started working in the technology commercialization group at at UW, which is called Commotion. And I kind of followed that lead into Fred Hutch, so I worked in the business development office there. And there were a lot of things that I liked about commercialization. I liked that I was able to actually kind of see an idea come from a research project and then all the way in towards like partnering with companies and becoming a product that could actually be used for healthcare. So that was really great, but I did kind of miss working with data. I miss kind of doing experiments, and I wanted to get closer back to the science. And so I started looking into data science and kind of teaching myself, and I liked a lot of things about data science. So I taught myself for probably about a year, and then to kind of wrap up my training, I went to the METIS Data Science Bootcamp, and I just turned off the presentation. There we go. All right. After I did the bootcamp, I finished that this past March, and was looking for new opportunities, and I came across the Data Innovation Fellowship between Cambia Grove and Fred Hutch. And this was a really great opportunity because it kind of allowed me to bridge my biology knowledge with the data science tools that I had just learned. And so it's been really great. Unfortunately, it is ending, so I am looking for new opportunities. So I would like to stay kind of within the biology or the healthcare space, and working with data and building products. So now I'll move on to what we've actually been doing over the fellowship. So our first project is looking at reference data and kind of aggregating it from several sources into one cohesive source. So you might say that seems kind of simple. Why is this difficult? So every different site has its own format, its own different structures, and oftentimes different naming conventions. And so our idea is to kind of put them all together into, sorry, I did that again. So is to put it all into one location. So we used Amazon S3, and our idea was to pull it all together and then organize it and give out public access to it through kind of a cohesive structure such as an API. So I'll go through visually kind of what our framework was. So we looked at 25 different sources, so kind of including NCBI and PubMed, and then we used code to kind of extract the data out of these websites. We used we translated it into a compressed data format called Parquet, and then we stored it in Amazon S3. And then altogether, this was about 2 terabytes of data that we stored in S3. And then we used a tool called AWS Glue, which kind of allows us to look at what's in this data storage and pick out the metadata from it. So what this would mean is if you have a table in your S3 bucket, you can tell Glue to look at your table, and it will say, okay, these are your column names. This is what data type is in your column, is stored in your column as well. And so this is really important for being able to query what's in your storage, as well as then to pull it out and use it in visualizations, which will come up later in the talk. All right, I'm gonna let Mansi introduce our second project.
Okay, so moving forward to the second project that we've been working on, single cell data analysis. But before we actually dive down into what kind of analysis we're talking about here, let's understand what are the pain points that researchers across the world are facing and why exactly have we done what we've done. So researchers are generating data all over the world, but not everyone knows how to analyze it, and we're here to help. However, the data that's being generated is not just in one standard format that everyone understands. There are over 5+ formats, each coming with their own set of tools. Hopefully words like Seurat, Monocle, 10x, or single cell experiment may sound familiar, because that's the kind of data that we're talking about here. When we generate data in different formats, it's very important that we understand how these data sets are going to, how these data formats are going to talk to each other, and then have them kind of interoperably working, because each comes with their own set of benefits, and we're trying to tap all of that. So one of the primary goal is, of course, interoperability between these formats. And then when researchers do some kind of analysis, we're talking about biomedical data. We're talking about predicting something that we're not sure shot. So when we do an analysis, we want to be as confident as we can of it. If we do the same thing using multiple pipelines and end up with the same kind of results, the chances that we're right are not 100%, but at least we're more confident that what we're doing is hopefully on the right track. So that's what we're trying to achieve here. And now getting into the actual pipeline that we're talking about. The very first step, a standard process in most analysis pipelines, is the pre-processing, which is the quality checks, normalization, and feature selection. So what you see, the image on the right, is actually something called as an expression matrix. It's kind of a mapping between cells and genes, and what we're trying to achieve here is understand which genes are highly expressed in certain cells, because that's going to help us come to some conclusion. But before we do that, we need to do some quality checks because we might have empty cells, we might have cell doublets, we might have dead cells, and we do not want to introduce those in our analysis pipeline. So let's get rid of them, let's normalize, and then decide what is a limited set of genes that we want to work with, which is what we call feature selection. Now, once we've selected our features, there's a very high chance that they're highly correlated. So we might not want to do the same thing with a larger set when we can actually identify those correlations and then compress the data into certain principal components. So that's what we do next. Once our principal components are done, it becomes relatively easier to understand what is the distance between certain cells, which ones are closer to each other, and therefore can we cluster them. So from there, we actually come into that beautiful visualization at the bottom, in which hopefully you guys can identify that we have some kind of clustering going on. Everything we spoke about is currently happening at a linear level, but when cells are introduced in the system, they not always follow a trajectory that we expect them to. So let's talk a little about nonlinear dimensionality reduction, which is achieved using t-SNE and UMAP. So this one is actually, if you can see, it's more nonlinear. It's slightly different from the clustering we've done before. And then we've actually identified, okay, now that we've done some nonlinear reduction, these are the new set of clusters that we've identified. Can we know which genes are highly represented in these sets of cells? And can we name them, which is our final step, differential expression of the gene and annotations. So this basically concludes the entire analysis pipeline that we've done. And we've tried to do it in multiple formats so that when we achieve this net result, and we kind of see some similarities, we know we're on the right track. So moving on.
And by the way, Mansi's the one with the computer science background, not the biology background. Kristin, who presented all the computing stuff, is the one with the biology background.
Yep. Thanks, Michael. Okay, so we walked through kind of our standard pipeline, and this is kind of the framework that most of the packages use, but they have slight variations between them. And so if you have just one pipeline and you want to run it, it's pretty easy to do just on your local computer, or using like a Jupyter notebook or a different development environment. But it gets a little bit more complicated when you add a second pipeline that you want to run, or even 4 more. So you could have the same language, but 2 different researchers have published methods, and you want to run it through both of those methods. So now you have 4 pipelines that you're working with, and it becomes a little bit more complicated to manage all the outputs, and especially if you do permutations on them. So this is kind of where workflow systems come into play. And so what the workflow system will do is it will manage your inputs and outputs and save everything for you and kind of run the process and split it up, if it needs to, into different environments. And then the other tool that we use that kind of makes the system very powerful is we used Docker containers. And so a Docker container is a virtual machine that you can run code in that is kind of packaged with the resources it needs to run your script. All right, so that's kind of the bulk of our pipeline, but we wanted to kind of step back out a little bit further and make it into a scalable system that multiple researchers could be using. And so I'm going to walk you through kind of how a user would interact with our system. So a user would upload their file, so it would be the expression matrix. They would upload it to Amazon S3. And then there's a service called AWS Lambda that's kind of watching this file. And it says, okay, there's a new file that's been added to S3. I'm going to now tell AWS Batch, there's a new file and it needs to do something with that. And so AWS Batch is then going to turn on Nextflow. It's going to say, Nextflow, start running all the pipelines. And that will then start up Docker containers for each individual step. And that will generate the data files that will then be used for visualization kind of further down the line. And so there's kind of 2 main features of the system that make it really cool. And so the first one is that we're using serverless cloud computing. And so essentially what that means is it's on demand, and so it's scalable and efficient. So if you want to do a lot of computing, it will run up it will start up a lot of computers, but when you don't want to use any computer, it's going to be turned off and save you money. On the other hand, it's also distributed computing, And so what this means is if you're running like lots of different permutations that can be done kind of in parallel, it can run them all at the same time instead of waiting for one to finish before the next runs. And so essentially what this means is you could run 1,000 permutations in the same time as you would run just one on your personal computer. And so now I just kind of want to wrap up with kind of the impact of our system, why we're doing it in the first place. And so really what it comes down to is kind of reproducibility and scalability. So say you're a researcher, you're very familiar with single cell analysis, but you only work in one library, and you're collaborating with someone else, and someone else who works in a different language, they use different tools, but you want to work with them and collaborate with them. So this kind of allows you to run your analysis through both pipelines without having to learn the second language. Or on the other hand, say you're working with single cell analysis and you really know the programming side, but your collaborator doesn't. They still want to play with your data and see what you're doing, and this kind of allows them, since it'll be on the web, they can play with your data, see what it's doing, but they don't actually have to touch any code. So that really makes it kind of accessible to a wider audience so that many people have access to single cell analysis. And then the other system is it's also very scalable, which is really nice, so that multiple users can be using the system at one time. Okay. And so with that, we just kind of wanted to say some thank yous. So thank you to Cambia Grove, especially Jessica, for kind of organizing this project. It's been a really great learning experience.
Yeah, and thank you to Michael and Gretchen from Fred Hutch for being amazing mentors to us for the last several weeks. Thank you so much. And let's just clap for ourselves. These are our data coordinates. Please reach out to us if you have any feedback for us, if you liked or disliked what we spoke about, or if you want to chat further. We're also back at the back. We have our own table, so come and say hi if you want to. Thank you.
Awesome. Well done, ladies. So without much further ado, we'll go ahead and call up our first company. We have Tomorrow Inc. to start us off.
Hello. Just to let you guys know, we get 90 seconds each, so it won't be too long. So my name is Jo Masterson. I'm the co-founder of Tomorrow. That's spelled with the number 2, which is why I get to go first. We're a digital health company that specializes in delivering evidence-based behavioral science programs via the smartphone. We call this digital coaching, and we do that for employers, states, health plans, and providers. Today I'm going to be talking about something that you might have seen in the news recently, and that's teen and youth vaping. In the state of Washington alone last year, 25% of high school students admitted to vaping. From our surveys and analysis, they're telling us that that's much higher, and pretty much all of them think that their parents and teachers do not believe they are doing that. And so this is a huge epidemic. It was kind of promoted to them in general as something that was safe, definitely safer than smoking, and many of them thought that it didn't have nicotine or anything bad in it. It's just vapor. At this point, what we've got is a new generation of people addicted to nicotine. We also, if you've been watching the news, have seen some serious lung disease and even some deaths attributed to vaping. Some of that's vaping THC, some of it's nicotine, we don't really know, some of that's off-market stuff. It still might be a decent harm reduction for current smokers, we don't know that, but what we do know is that nicotine is extremely addictive, and nicotine delivered via vape is even more addictive. So what we've got here is last week, Tomorrow, along with the state of Washington, launched the first app that is designed for teens and young adults who want to quit vaping. It was launched, some of you might have seen it in the media. The state of Washington will pay for it free for anyone in the state who wants to quit vaping. They helped fund the project. This program was initially developed with the help of Fred Hutch Cancer Research Center. Dr. Bricker there helped us deliver our regular nicotine and smoking tobacco programs. For this one, we worked with researchers from Fred Hutch, from Seattle Children's, from the State of Washington Department of Health's Tobacco Group, and from a lot of K-12 educators, really high school educators, and then a bunch of teens and young adults as well. That's basically what we're doing. It's super cool. It's available to anyone in the state for free. Our little booth says digital coaching at the top. If you have patients or populations that you think could benefit, let us know. And no, I don't know how to make them want to quit, but they are starting to get a little nervous with all the data out there. And most of them are very surprised to realize they are addicted to nicotine, and vaping looks like it's more addictive than cigarette smoking. So it's not going to be easy for them if you have kids doing that. It's a challenge. That's all.
Thank you. I'm happy to give that to the next one. And next up, we have Brainchild Technologies.
Hi, I'm Carly Kislisnik, the founder of Brainchild, and we're working on a new platform to identify hearing loss in infants with a smart pacifier. So most states have really strict mandates that all infants should be screened for hearing loss because it has such a crucial impact on language development. Providers and parents struggle to meet these mandates because it's one of the hardest ages to detect a hearing loss. Right now, we have to go to a specialist, use an expensive medical device for a physiological response to sound, because a baby can't do the gold standard of just raising your hand and telling you, I hear that sound. What we're trying to do is fill the gap for a behavioral measure of hearing by measuring sucking response to sound. It's one of the few behaviors a baby control from birth, and they naturally change that in response to sound. Researchers in baby labs have a long history of wiring up a pacifier to do language studies. So what we're doing is creating a low-cost, off-the-shelf version of that established research tool. We have a smart pacifier. It measures sucking rates and allows the baby to control images or sounds on a connected device. So it's like a remote control for a baby. And then we have various different apps, and the first one being to calibrated sounds of a hearing test. And this will help improve the quality of hearing assessments for the audiologist. But because it's such lower cost hardware, it will finally be able to widen distribution to a new market in the medical home and fill in that key gap for regular hearing screening for preventative care. We also then can start building for other data on more complex neurodevelopmental disorders as well. Thank you.
Thank you. Next, we have Keira Cloud Corporation.
Hello, everyone. Good evening. My name is Xiaoxiao Liu. I'm the product director of Keira Cloud. We are a startup company that was founded 4 years ago right here in Seattle, technically 8 minutes drive from here. We provide AI development services to healthcare organizations, including hospital networks, medtech vendors, and research organizations in biotechnology. And we have a house of more than 20 machine learning scientists, computer vision experts who are dedicated to apply the state-of-the-art deep learning technologies to medical data, including, but not limited to, X-ray, CT, MRI, ultrasound, pathology data, and electronic medical records. We work with physicians, including radiologists, cardiologists, oncologists, pathologists, to develop tools that can help them to increase their workflow efficiency, provide better quality assurance, and lowering the costs and ultimately benefit patient care. In a sophisticated healthcare world nowadays, we believe true innovations starts with collaborations. So please talk to us. We're right there. Our team will be happy to show you a demo. Thank you.
Thank you. Next up, we have MedCents.
Hi, I'm Dr. Tapikin, founder and CEO of MedCents. For many older adults, the ability to remain independent upon one's home is dependent upon their ability to manage complicated medication regimens. Each year, over 270,000 deaths and 23 million ED visits are attributed to medication mismanagement. Individuals, families, and caregivers who together are responsible for care are clearly stressed, overwhelmed, and do not have the tools to safely and effectively manage medications. This problem is only going to get worse as every day for the next 19 years, 10,000 people turn over the age of 65. MedCents solves this problem as an affordable turnkey solution for medication management. This includes attachable sensors that convert literally any medication container into a smart device. These sensors transmit data to the cloud by way of our proprietary hub, which are analyzed with machine learning and AI to determine valid consumptions at 99% accuracy. Supplemented with voice-enabled alerts and reminders, MedCents enables safe and stress-free medication management for families and caregivers. I look forward to showing the demo and some of the machine learning stuff we've got. Thank you.
Thank you. Next up, we have Navigating Cancer.
Hi there. My name is Brian Shee, and I'm a senior product manager over at Navigating Cancer. If you're like me and my colleagues, you or someone you know has been touched by cancer. That's why every day we are laser focused on making sure we improve the lives of cancer patients and those who care for them. We offer a comprehensive solution for patient relationship management that basically enables patients to receive better, more efficient care at a lower cost by putting the patient at the center of the experience. Specifically, patient issues are addressed quicker as nurses no longer have to juggle multiple voice message boxes and Post-it notes, and instead they can run through a list of prioritized patient needs, ultimately helping patients quicker. Second, symptoms are proactively managed in a systematic fashion to help avoid expensive hospital visits and ED visits. Third, patients are able to live their lives to their fullest by just managing their day-to-day through remote patient monitoring, and they can stay in touch with their care teams. We've learned a lot over the years, and we've been able to manage the value-based care requirements as well. And for example, there was a recent study that showed a 7% reduction in patient ED visits for 2 of our clinics, resulting in $3 million worth of savings. If you're interested in learning more, come find us over in the corner where we can talk more about our solutions and opportunities for how you can help improve the lives of cancer patients everywhere. Thanks.
Thank you. Next, we have Ohmic.
Hi, everyone. I'm Gabe Richman, founder and CEO of Ohmic, and we are powering genomic medicine. Our mission is to ensure that everyone has access to highly personalized care plans that enables us to steer around disease. And our goal is for healthcare providers to be an expert in your genetics and for every patient to benefit from the treatment of others through a multi-omic analysis and AI platform. We work with employers and advanced primary care providers on population health and precision medicine initiatives, and we focus on chronic, complex diseases like diabetes, cardiovascular disease, and cancer, where the prevalence and costs continue to grow. Our team looks forward to talking to you this evening, and thank you very much.
Thank you. Next, we have Plain Concepts.
Hi, I'm Jose. I'm sorry, I'm not PhD or CEO or kind of. I'm just a business development manager of Plain Concepts. And today we're going to show you some augmented reality tricks. So, you know that 4 out of 5 biopsy needles are failing every day. So that could mean to more pain for our patient, more tissue damage for our patients, and of course, more patient unsatisfaction. So we have partnered with an European hospital to develop a biopsy assistant. So what we do is to train better the doctors so they can perform better while doing the biopsies, and then to help them live tracking the biopsy. So at the end, the results speak by themselves. We are driving between a 500 and 600% improvements in the pains of the patients and in the damage of the tissues, because we are training better the doctors with the HoloLens experience. So we will be very delighted to show you this experience and see what can we do with this biopsy experience. Thank you so much.
Thank you. Nothing plain about that, right? Next up, we have Samaritan.
If you saw me on the off-ramp holding this sign, would you trust me? Would you believe that I was truly in need? Would you have the time to stop and engage? Would you have cash on you to give? Would you wonder if giving cash was truly the best way to help? Friends, as you step out this evening, you'll be quickly reminded that homelessness is one of the greatest issues of our time. Healthcare systems, governments, nonprofits are spending hundreds of millions of dollars per year combating it. And they know we are losing. 4 years ago at 6th and Columbia, I met the man holding that sign. Alongside people with lived experience, we have developed this smart wallet called a Beacon, specifically designed to help people address critical determinants to their housing and health. We basically provide these beacons to care providers who offer them as a resource for the people they serve. If someone has a beacon, you can learn their story through the free Samaritan app and invest in their goals and their needs to finding their way off the street. Beacon holders can spend funds with a clinician or a counselor or at a partnered merchant and meet monthly with that counselor to update their goals and needs for the 30 days ahead. Friends, we have seen this combination of financial and social capital yield life-changing outcomes like housing, substance treatment, employment, and significantly lower cost of care during a 500-participant trial here in Seattle. The platform is available now for care providers and nonprofits to use in their work. If you're interested in learning more, come find us with the cardboard signs in the back. Thank you.
Thank you. Unfortunately, this is my one good pun of this entire evening, but it's not to zig, it's to zag.
It's to zag. Hi, I'm Neil Sofian. I'm the CEO of TUZAG. 50% of all healthcare costs are tied to people's behavior. Going to the right doctor, exercising, taking your drugs, whatever it is. That's 1.5 trillion bucks. And there are 150,000 apps, some of them tonight, that are out there to help you do something about that. Guess what? Engagement in those apps suck. Fundamentally, people aren't using them, and bottom line is if it ain't dog food if the dog don't eat it. If we are going to get people to actually make behavior change, we are going to have to find a way to connect to them and have infinite conversations with them on an ongoing basis, which means knowing more than their genome, their binome, their claims, their costs. You need to know them, their values, their hobbies, their family circumstances, their vulnerabilities. And what we have done is developed an AI, infinitely variable AI concierge that gets to know you and then tie you to the services and products that make sense for you. Because fundamentally, telling people what they should do, telling them you should do this, when you do this to people, they do this to you. We have the ability to actually create those digital relationships, creating trillions of iterations of messages and connections. If you'd like a demonstration, come on over and meet us, and we'd be happy to show you how we do it. Thanks a lot.
Thank you. With a last name like Walker, I always feel like I have to say, last is definitely best. And with that, Vism Technology.
Too kind. Hi, my name is Sean Buchanan, and I'm the CEO and co-founder of Vism Technology. Surgery is not safe. 75% of surgical error that results in death occurs in surgery. It's clear that surgeons need help. We can't see or visualize inside the human body the way that we need to for surgery. It's difficult to locate a tumor inside a brain and cut it out. Vism solves for this. We provide the 3D visualization assistant that gives surgeons mobile X-ray vision. We use this utilizing the Microsoft HoloLens, and this solves for one of the biggest issues for surgeons because now they can focus directly on the patient rather than looking up and away at a monitor, which is similar to distracted driving. Unlike others, we recognize the patient in under a minute and can overlay that patient-specific anatomy directly on top of the patient. With that, our 3D on-demand visualization assistant can help surgeons de-risk complex cases, and they can identify critical structures such as a tumor with dynamic 3D imagery as well as real-time patient data. And what this also allows is for patients to better visualize and understand their upcoming procedure. Surgeons can guide that patient through their patient-specific anatomy that helps them increase confidence as well as establishing trust. We're currently working at Overlake Hospital with surgeons there, as well as Medical University of South Carolina, Stanford, And we're actively seeking for more partners to launch with our patient engagement beta release, which we're demoing in the back right now. If you'd like to learn more about how we enable a future of surgery without compromise, please come find us. Thank you.
Thank you. Let's give another round of applause to all of our innovators.